Hey Nadia,
Hello.
how's it going today?
I'm good. How are you?
Good. So today we've had this chat saved for a while and we finally have time to talk about it. You had asked about basically childbirth a few weeks back,
hmm
and I'm excited to talk to you about it and then at least my experience and maybe see what kind of questions you have.
Yeah. I feel like I have a lot of questions, but I also haven't watched I feel like people have watched videos of it in health class before. I don't know. Or maybe that's just in TV shows, but I've never seen it. I don't know that much about it apart from what I assume.
Oh, let's see. What do you assume? What do you assume that
Well,
childbirth is like?
I understand the basics of dilation and stuff like that, but Um, other than that, I just know you go into your water breaks, you go into labor, and then you have a baby. Not that basic, but I don't know the specifics. Not that I want you to go into all the specifics, but I'd rather hear about your own personal experience.
Hmm. Okay, so I think it's pretty interesting for me to hear what it is that you know. So basically, you said you your water breaks, your cervix starts to dilate, it
hmm
gets to a certain point, and then what do you think happens?
And then you push the baby out,
Hmm. Yeah, and
or you
I'm
get a
assuming.
C-section.
And I'm assuming you think of this all as pretty painful.
Yeah, I feel like it depends on the person though. I feel like a lot of people's experiences are very different. So, which is why, I don't know, I can understand some of the basics, but not really how it's gonna look for like when it happens to me or.
Right, right. You're right. It's really individual. Like
Right.
the experience is really individual and can be different from one baby to the next. Um, and do you have any idea of how pain is controlled when you are in labor?
You can get, oh my god, I'm blanking on the name.
An
You
epidural.
can, yeah, an epidural. You can get epidurals. But a lot of people prefer to have natural births, so no epidural and stuff like that. But and I know when you have a C-section, you obviously can't feel it, but I feel like I know all everything that other people would assume in addition to what I've seen watching Grey's Anatomy and The Resident and any other show where there's a pregnant person in it.
Have you been starting to watch The Resident?
I did start to watch it. I feel like I'm in this weird era of starting so many shows at once. So I'm currently watching The Resident and in the City and This Is Us. But I think I like This Is Us the best.
Oh my
So
gosh. This is us is so
it
sad.
is extremely sad. And one of the characters just had a baby. So
Oh.
I feel like I learned stuff through that. But yeah, I did watch The Resident.
Yeah, I've been watching that too. I'm in season 2. Okay, so what about do you have any idea about the what happens before you give birth and after you give birth?
What do you mean?
Like, do you know anything about the care that you have to um or that you benefit from
Well,
receiving before and after?
um no, but I do learn some stuff by watching TikToks. A lot of moms will post their stories on TikTok, like their birth stories, and obviously I have to watch. I don't know, they're just interesting. But I like you had a doula, which and people have midwives, which helps with like the whole preparing for it process, I assume, and during. And then afterwards, I know there's a lot of, I don't know, things you have to do to take care of your body post, you know, having a whole child come out of
Yeah.
you.
I mean, that is like a step in the right direction. I was waiting to hear what you were going to say. I thought you were going to say something like, well, after you give birth, I know there's a lot you have to do to take care of the baby. And that is true. But I
Well,
think
yeah.
like knowing that you have to take care of yourself too, there's like a lot of physical stuff to take care of for yourself too. That's,
Yeah,
thank
because
goodness.
it just doesn't go back to normal right away, which
Yeah.
is super interesting and very difficult as like probably as a new mom, or even not a new mom, just like a person that just gave birth. But yeah.
Okay. So, prior to having the baby, well, I mean, prior to childbirth, basically you have to go to the doctor pretty often
Oh
to
yeah,
check in
yeah.
and make sure that the baby's developing okay. And there's lots of different tests that you can do along the way to find out the gender, to find out if the baby's potentially has some health issues. You yourself need to be checked health wise to make sure that your blood pressure is staying okay and your sugar and insulin levels are
Yeah.
good, and you and then and mental health, because there's a lot of hormonal changes happening. And then as you get bigger, your body changes shape, obviously, and there can be aches and pains associated with that, which sometimes make certain activities that used to be easy and pain-free for you a little bit more challenging.
Right.
So, you might get some care related to that, whether it's massage or physical therapy, to help with some of the aches and pains associated with the changing shape of your body. And then oftentimes families will go take classes to learn a little bit more about labor, delivery, and then like nursing after
Right.
having the baby. So then so as far as like, so that's general. Now, as far as my story, as far as when you were born,
Right.
you were 4 days late. By that point, I was already like anxious to get things going. And there's all kinds of thoughts about what you can do to make labor, to bring on labor, if you're ready, if the baby is ready to go. And so I actually did acupuncture a couple times to see if that could get things going. And we joke, your dad and I joke that like we had spicy food, took a long walk, and then got in a little bit of a fight the night before you were I went into labor. And so maybe like, I don't know, maybe all that stress brought it on, or maybe you were just ready. And then in the middle of the night, like around midnight, I started feeling like contractions. And prior to you actually being ready to deliver, your body starts doing practice contractions ahead of time, where you kind of feel everything squeeze.
Is it the Braxton Hicks?
Oh yeah. Did you learn that from Grey's Anatomy?
Maybe.
Yeah. So then somehow, like, 'cause I've only had 2 babies, so it's not like I'm an expert on these things.
Right.
But I do remember this feeling that it was a different kind of contraction, and me wondering, like, I wonder if this is it.
Right.
And I didn't wake up your dad right away, but then probably around 3 or 4 in the morning, I did wake him up. And we contacted our doula to let her know that I was in labor. And then I don't remember how we knew to go to the hospital, but we did. I mean, this is the thing. You choose when you're going to go to the hospital, right?
Right.
And I think when you know you're going to deliver in a hospital, if you know where you're going to deliver, when it's your first baby, maybe you get there sooner rather
Right.
than later
Rather than
because you just
later,
like
yeah.
don't know how things go.
Right.
And you had said like, oh, your water breaks and then you go into labor, but my water didn't break right away. It was contractions and my water didn't break right away. And so we went to the hospital. They said, yes, you're in labor. And they gave me a room. And actually, weirdly, this is like a weird story that I'm guessing the hospital will not like that I say. So I remember going into the hospital bathroom and looking at like the toilet, and there was like blood on the toilet seat. Ew.
Ew.
I was so grossed out. I was so grossed out. And on top of that, I was in
That's
room
disgusting.
4.
Yeah.
And my mom told me that 4 is bad luck. I think it sounds like death in Chinese. I don't know. We're not even Chinese, but somehow she knows that. And she like didn't want me to be in room 4. Anyways, so we go into this room. It's room
You're like,
4.
I gotta, yeah.
There's blood on the toilet. And then, they say that I'm in labor, but I'm like really just like early on.
Right.
And I asked them if I can please just go back home because I'm far away from actually pushing you out. I want to labor at home. I did not want an epidural if I didn't need it. And so I had to sign all this paperwork that said like, they don't suggest. They don't suggest I go home, but I'm going home. Also, you learned this from Grey's Anatomy or The Resident?
No, but like, I feel like that's
common knowledge.
Yeah. Did you have a hospital bag, like your give birth with me bag?
Yeah. I had a bag, had some clothes in it. I don't remember what else is in there, but probably some toiletries. And we had already brought that. And actually you go with you make sure that your like car seat's already installed. Because when you bring home the baby, you got to make sure that you have a car seat.
Yeah.
So I signed the paperwork. It actually took a long time to get everything going. And then I went back home. And eventually my doula met me there and she was experienced, right? So she probably knew that it was going to be a while, but we're like, you need to come now because I'm like in labor. And so she eventually made it and tried to do all kinds of things to make me comfortable. But the thing that I remember the most was that she made breakfast for Eric. She made breakfast for your dad. And there was times I'm just like sitting in my room, like on my own, especially in the beginning. Then later on, it was so painful. It was really painful. Like I just remember
You're welcome. I'm sorry.
I remember being in the shower trying to make it feel better. I just remember thinking to myself, I cannot believe how painful this is. And I also couldn't eat. I also remember like just kind of being exhausted and feeling nauseous and couldn't eat, could barely drink water, had to chew ice chips. And I remember my doula doing like visual imagery with me to try to keep me calm and in a happy place. But she tried to take me to the beach and I wanted to go to the snow. I wanted to be in the mountains snowboarding. Eventually I went back to the hospital and I remember my doula saying, do you want to walk in? And I was like, are you thinking in my head, are you kidding me? I don't feel like I can walk in, which I don't think is necessarily, I think she's trying to empower me. I think some people can walk in, not come in all like, I need to be seated, but I could not I could not walk. And I remember being in the elevator and there were just regular people in the elevator with me.
And you're like in labor.
And I was in extreme pain and like maybe yelling or like maybe like grunting. But they're just like, can you imagine if you were in an elevator with somebody?
Yeah. I don't know, but I feel like I'm kind of biased. I feel like pregnancy and like giving birth is just so cool. So I'd be
Oh
like,
yeah.
oh my God.
I mean, it is pretty cool. You know, there's a baby inside you and then it's coming out. Okay. So am I taking too long with this story?
No. It's
Okay. So
okay.
basically I get there, they check me, and I don't remember the details, but pretty soon later I started to push. Now, mind you, this whole time I didn't have an epidural. And the reason I didn't was because of, I don't know, maybe for the same reason people run marathons. Like I just wanted to see if I could do it.
Yeah.
I also, there's a lot of like, I decided to, believe the suggestions that it's better without the, pain medication. And I actually have scoliosis, and then, they're putting an injection into your spine. And so I thought maybe I'd be complicated because my spine's crooked, and I just didn't want any complications.
Yeah.
So
you can't really move anyways.
Right.
So it'd be too complicated.
Right. Yeah. So I started to push. I think I pushed for 3 hours.
Mm-hmm.
And interestingly, what they want you, or I don't know if they still ask you to do this, but for the most part, they tell you to, or at least 20 years ago, they would tell you to hold your breath and push. But that is exactly like not what a physical therapist will tell you to do. So I'm not really sure what they say now in those labor delivery rooms, but
why would you want to hold your breath?
To increase your intra-abdominal pressure so that like you're like kind of squeezing it out,
I know,
but then
like
then it's like boop,
but then like the PT wouldn't you want to like breathe and then
relax
it out?
Yes, exactly. Like, do you want? Yeah. Anyway, I was about to go to the pooping analogy, but that's another thing. Did you know how different it felt with the epidural? All of a sudden,
you don't need to further elaborate.
No. All of a sudden, I felt like a normal person, and I looked around at the people.
You went to bed, and then you tried again. Did you wish you got it earlier? Yeah. That's funny. Right. Yeah, right. You could have made that up. Yeah. Amazing. But you didn't have any like complications apart from that? Apart from being in labor for like a really, really long time. That's crazy. An epidural, yeah. Can you imagine? But what else? Yes, it is. You're just a little bit blurry. then mine's still recording. And you're less blurry now. Or never mind. You can press start again. I don't know what it's gonna do. So you leave and come back. I can't start and stop. Hey guys. Okay.
Strange.
I mean, it's still recording on my end, I feel, but okay. Where were we?
Okay. Where were we? No, seriously, where were we?
I don't know, technical difficulties. But you were talking about being sewn up.
Yes. So as far as other complications, I remember having to get sewn up down there.
Mm-hmm.
And I was really glad to have an epidural for that. And then I think one thing to note is that they're like, not with you, but with your sister, I was having a lot of pain right after giving birth. And apparently it was because like there was a blood clot like forming in my uterus and just like kind of getting bigger and bigger.
Ow.
It wasn't that I hadn't delivered the placenta. I'm not really sure what it was about, but it was really uncomfortable. And my point is to say, I don't know the details of that, but of what was actually happening there medically. But my point is to say, I really had to advocate for myself at that point because it was very uncomfortable. I did advocate for myself, said I was uncomfortable, and they just gave me Vicodin. And then I was very uncomfortable and nauseated from the Vicodin. And so they, it turns out, I think they just had to like push on my uterus and like kind of let something out, and then we were good.
Well, I have two questions. One, is delivering the placenta like delivering a baby? Like, is it the same sensation?
No. By that point, no, you can't feel much at that point. I mean, I don't know. I've not had that many babies, but like I did not feel placenta coming out.
And
at that point, you've squeezed a head out this big, so you're just like, meh.
I have two more questions. Another one is if Lucy, my sister, if her birth was similar, like, did you feel like prepared going into it? And then afterwards, was it like, oh, that was very different than the first time? Apart from being in labor for not 36 hours.
Right. So it was faster, not that much faster. I mean, I think it was like 10 hours or something like that. The things that I remember are that it was faster, that I had to find a place to put you. Like I didn't want you in the house while I was like in labor. And I did give birth to Lucy without any pain medication.
Okay.
Except I did use a TENS unit, like similar to what you use in physical therapy, like electrical stimulation unit at my back. And I used a protocol that is used in other countries with the TENS unit. And I don't know if that's the reason why I was able to withstand the pain, or if if that's why I was more comfortable, but it could be. And I also remember that by the time I got to the hospital, they were like, okay, first go to the bathroom and like sit on the toilet, and then we'll check you. And I was like, I think I'm ready to like deliver. And they're like, go ahead, just go to the bathroom first. I'm like, okay, but the baby might like come into the toilet. And so I just did what I was told, and I went on the toilet, and then I laid down, and they're like, oh yeah, you're ready to push.
Yeah.
So yeah, so she was,
like,
yeah,
I know.
It was much faster, but I remember, so for her, I was more uncomfortable after giving birth than for you. And then I think another thing to note is that nursing, like breastfeeding, doesn't always come naturally to people. And sometimes the milk doesn't come in right away, or the baby doesn't quite figure out how to latch.
Yeah.
And that can be a source of frustration for a lot of women because you really your one job is to keep this baby alive, and this thing that your body's supposed to do is not working the way it's supposed to.
Right.
You just feel like a lot of pressure. And also physically painful. Like if they don't latch on, or you have like sore nipples,
right.
it's like, it can be so painful. And it's like this weird disconnect. Like you have this baby, cute little baby, she's hungry. And then she like latches on. It's like, oh my God, it hurts so much. And that's kind of like a hard, weird disconnect. But yeah, so in those situations, like, I think it's really helpful to interact with a lactation consultant that can help figure you out. I think it's important to get a lactation consultant to help you right away, like when you first give birth, just to make sure, because when making deciding on a habit that could result in discomfort later, if you decide on that habit while you're in the hospital and it causes problems later, it's better if you address it before it becomes a bad habit.
And did you have any trouble with that?
I didn't. Well, I did. One, I produced a lot of milk and I felt like it was like you guys were drinking out of a fire hose. Like sometimes the milk would come out and you guys would be like choking. And then the other is when Lucy was born, I was more like confident about nursing. So I decided on an advanced nursing technique when she was still young, like the side lying where the baby lays down on the bed and the mommy's lying in the bed. But I think she's too little for that at that point. And so she developed some weird habit that resulted in very sore nipples. So that was no good. Too advanced. And I also got mastitis, which is like an infection of your milk ducts. And I remember that feeling literally like I've been hit by a truck. That was the worst flu. It's like a flu, but really bad. Maybe because you're just already so tired.
Yeah.
And those were the complications. But I was in a group with women that would meet with a lactation consultant on a weekly basis and just come, we'd ask questions and bond with each other and weigh the babies and all this stuff. It would kind of was the practice's way of making sure that all of us worried moms wouldn't go to the doctor all the time because our questions would always be answered. And oh my goodness, all the other women that I met with, there were so many questions and so many issues amongst those women.
Yeah. I think there's a group like that at the health center that I work at.
Oh,
and
cool.
they meet on Wednesdays.
You should go.
Well, I'm at work, so I can't necessarily join their little meeting. But I had one more question. Did you experience like morning sickness or cravings or whatever, all those, while you're pregnant? Yeah, symptoms. Not symptoms, but like
nothing super bad. I felt a little bit of nausea, but never threw up. When I was pregnant with Lucy, 4 months pregnant with her, that's when I was interviewing for PT school and not showing them that I was pregnant. I was already nervous and I was wearing a suit that was too tight for me. So I felt pretty nauseous from nerves and probably from being pregnant. So I was pretty lucky with that. And then cravings. Yes. For one of you, it was mangoes, and the other one it was pomelo.
I'm just trying to guess who would be who, but I don't know.
And I remember Annie's mac and cheese tasting like vomit after a little while, which I used to love it. The Annie's
great.
white cheddar.
Yeah, I love that. Nothing can change that.
You would think.
I don't know if I had any other questions, but yeah, I really like hearing. I mean, I feel like you definitely told me this story before, but not in the sense of I'm gonna ask questions afterwards. But yeah, thanks for sharing. I feel like if I like interviewed a bunch of pregnant women that like I knew, or well, I don't really know any pregnant women, but that I came across, they'd all tell different things. But
yeah, I know. I have a friend who never felt the labor pains, and she still asked for an epidural just because she was afraid that they were going to come.
that's funny.
I have a friend that almost gave birth on the way to the hospital. Yeah, and then there's some scary stories too.
Yeah.
Your coach was just saying that she had twins. Your old gymnastics coach, and the first baby was head first, like it's supposed to be, and then the second baby was feet 1st. He had flipped, and there's not everybody is trained or knows how to deliver a baby feet first, but the feet, like the doctor had to grab the 2 feet. And she says, I mean, this is not my story to tell, but it's kind of a cool story.
Yeah.
He said, I have a foot. And then the attending was like, you need both of the feet. So he grabs both of the feet. And then from above, there was somebody pushing the baby downwards.
Why does it need to be head first? Because then the limbs don't get stuck.
Yeah. Yeah. Because like
right?
I actually don't really know the answer to that, but I'm assuming it's because like, like
then
the limbs
can
get like
stuck.
yeah.
Um,
I'm guessing, I was like, did the arms go by the side or up like this?
Yeah.
I think up probably.
That's kind of interesting to have, like, if you have to experience someone that you know is not the attending to it, and then like watch them like learn while they're giving birth to you, while they're helping you give birth to your baby. But
I know. Yeah. I mean, you know that there's somebody experienced in there, and you know that everybody has to learn somehow. Like everybody has their first time, right? But when she was telling me the story, and me knowing that you want to go to medical school, I was like, wow, in a few years, that's like Nadia going, I have 1 foot. Now what?
Yeah. Interesting, but very cool. Can't think of any other questions that I have. I do feel at this point in my life that I do want to be pregnant at some point, not right now. I don't know. You always said you felt you were like destined to be, or that you always knew you wanted to be a mom.
Yeah.
I feel like I not that I have to, but I have to experience pregnancy at some point in my life, or having a baby. I don't really need the giving birth part, but
I mean, I hope that if you get pregnant, you give birth and have the baby.
But if I don't get pregnant, I would like to have a baby.
Oh, okay. You don't have to be pregnant.
Yeah.
But it would be cool to experience it.
Yeah.
Do you have any concerns about you going to medical school? Like, when you graduate from college, you'll be 22 or 23. And then you're probably going to take a year off. And then say you get into medical school right away. Say you're 25 at that point. And it's 4 years of school, so 29.
I don't
And
know if I
then,
want you to ask this question.
and then, like, depending on your specialty, you can have your residency for 2 to 7
3
years.
to 7 years. Oh, is it 2 to 7?
I don't know. I'm not sure. So then now you're like 31 to 36.
Yep.
Does that like have any bearing on decisions for you?
No, I still want both as of right now. And I feel like if I want to make it happen, then it'll happen. And I also can go to medical school. If that's what I decide to do, I can go whenever I decide. You know, giving birth and being pregnant does have a timeline, but like medical school doesn't necessarily have to happen in that exact way. Although it would be preferable. I don't know. I was just thinking today, I was talking to my friends too today, that like it's hard when like the end goal is so far away and so expensive. But I don't know. I feel like right now in the end I feel like it's worth it. And I like not having that pressure of being a like quote unquote pre-med major right now, which like pushes me towards like a certain timeline, but I still get like the structure of, working towards, meeting all the requirements, but at my own pace. I don't know. Obviously it's definitely going to be a bigger like conversation later on, but right now I feel like if I want both of those things, then just gonna have to happen that way, because I wouldn't give one up for another.
Mm-hmm. Yeah, I mean, obviously, there's so many physicians out there that are women and have kids. It's possible.
Right.
Mm-hmm.
I don't even, I don't know. But yeah.
All right.
Well, thanks for sharing.
You're welcome. All right. Well, I hope that you're not planning on getting pregnant anytime soon.
Trust me, I'm not.
All right. Have a good night.
All right. Good night, guys.